on Gerontology's Donald Menzies bursary in 2022, and I was really honored to receive the award and really grateful for the opportunity to participate in CAG's webinar series. So the main topic of my presentation will be adult day programs, and I've been working in and with day programs since about 2011, so I've kind of integrated this interest throughout my formal education in high school, my undergraduate degree, my master's thesis, and now my doctoral research as well. And I've also been working as a student in kind of multiple disciplines, including recreation therapy, social work, speech language pathology, kinesiology, and health promotion. So I kind of come to this topic from a variety of disciplines and kind of interests. And today I'll be presenting my research that was part of my master's thesis. So the presentation will kind of reflect the master's thesis process. So I'll discuss a little bit of the background and rationale for this research, some of the kind of study details, including the kind of methods and participants that were involved, before turning to the findings and discussion, and then future directions as well. So kind of giving an overview of what day programs are. Adult day programs, or ADPs, are part of the home and community care system in Ontario, and they can be defined as a service that provides support and respite for unpaid caregivers and through the supervised programming for adults, typically with chronic conditions. These clients and caregivers are usually older people, and the supervised programming typically takes place in a group setting and can involve activities like therapeutic recreation and leisure, physical activity and exercise, intergenerational programming, foot care, hair care, socials, and many other types of programming. Research and great literature often identifies 3 different purposes of ADPs, which are to provide support and respite for caregivers, to preserve functioning of clients, and to prevent or delay people from relocating to care facilities. And research has substantiated that day programs provide respite and support for caregivers. However, findings regarding the other 2 purposes, regarding client functioning and relocation to facilities, are less established and often mixed when explored using research. So researchers have theorized a few different reasons for these mixed findings, and we'll kind of explore those together now. So day programs are largely described as having developed in communities based on their needs, and many, but not all, either initially emerged from or have eventually partnered with existing organizations to provide services. And this tailoring of programs to the local clients, as well as the responsiveness to local population health needs. However, this individuality of programs also makes it difficult to kind of standardize policies, practices, procedures, and services. Some researchers have also questioned whether the current purposes are operationalized appropriately. So, for example, researchers have suggested broadening the focus on physical health functioning to encompass other elements of health and well-being, such as psychosocial outcomes. And some researchers have also suggested splitting this purpose into 2 separate purposes regarding psychosocial well-being and physical functioning. I also just got a notification that I have unstable internet, so if I cut out or anything, please just let me know.
Yeah, it's cutting out a little bit, Deanna. I don't know if
Okay.
there's anything that you can do. The only thing I know is sometimes turning off your video can help a little bit, but we want to see you as well. So it's up to you, but it's cutting out a little bit at times.
Okay. If it gets worse, I'll turn the
Sure.
video off. Yeah.
Okay.
Thank you for that. There also may be a lack of clarity regarding the distinction of day programs from other age-related services, such as long-term care facilities and older adult centers. So for example, the day services of day programs and the residential services of long-term care can sometimes be obscured because they can be co-located in the same building or on the same kind of environment. And the variety of terms used to refer to day programs within and across countries further complicates the understandings of the service. So for example, Orlana and colleagues discovered 10 different terms in their scoping review of day program literature that covered literature from 11 different countries. The types of day programs might also influence the relevance and ability to achieve some of the generally accepted purposes. And the terms used for day program types vary across regions, but some commonly offered day program types are integrated, which provide services for clients living with different conditions, all within kind of one program. and then dementia specific, which provides services to people living with dementia or memory problems specifically. And programs supporting individuals with progressive chronic conditions may not aim to prevent transitions to institutions, for example, such as long-term care, but rather focus on that delaying of relocation or moving to another facility. Likewise, the model of day programs might influence the relevance and ability to achieve some of these generally accepted purposes. So the most commonly referenced typology has three models, which are medical, social, and mixed, which each illustrate what is prioritized in service delivery. So a medical model focuses on clinical personal care and overall functioning, while social models focus on social interaction and therapeutic recreation, and mixed models have a kind of dual focus on both clinical and social purposes. And so as with the ADP types, the aims of ADPs may differ according to the model that people are kind of following with that program. And the previous factors discussed, specifically the combination of model and type, can also then influence the staff and staffing models, and then potentially the purposes of an adult day program. So for example, day programs following a medical model will employ regulated healthcare professionals, such as nurses and physiotherapists, who can attend to the clinical care needs of individuals. And ADPs following a social model employ people with expertise in social connection and recreation, such as therapeutic recreationists. And this staff expertise can then influence the relevance and ability of day programs to meet these generally accepted purposes. A mix of challenges and enablers to pursuing day program purposes might also contribute to the inconsistent findings regarding day program purposes and day program providers' abilities to meet them. So the optimal delivery of a day program may not be fully realized due to various factors that influence day programs in differentiating ways. Constraining factors may be hindering providers' capabilities to meet their purposes, and the most consistent challenge identified by the day program literature, primarily conducted in the United States, are funding and financial concerns, which often stem from inadequate government reimbursement if they receive government funding. Government funding given to day programs often does not cover the entire cost of service provision as well. Many research studies have also found that a lack of community awareness regarding the role of day programs and widespread misperceptions of day program as the equivalent to child daycare are challenges for day programs. And while enablers are much less often explored and discussed in the day program literature, they might still be kind of influencing day program purposes in some ways. And the research that has explored this topic has identified the relationships that staff build with participants and staff's dedication to their roles as enabling the pursuit of day program purposes. Despite the lack of evidence to support all three purposes, there is increasing interest in day programs in Canada due to potential implications for clients and caregivers, such as promoting health, preventing conditions, and allowing people to age in place or places. And the potential system-level implications these have, such as a modernized and optimized health system that supports people accessing services and is cost-efficient potentially. The growing interest in day programs in Canada is potentially unsupported, as much of the day program research is conducted in the United States, which might limit its applicability. And the existing research is also primarily conducted with clients and caregivers. And while these are really important and relevant perspectives to gather, perspectives from a variety of other parties are also really valuable. And directors might be particularly important or pertinent perspective when exploring purposes of day programs, as day program directors guide the operation of this service according to their perceived purposes. So day program directors are also aiming to achieve these purposes through various enabling and challenging factors and contexts. And they're also uniquely positioned to connect with many other day program partners, including interacting with clients and caregivers, frontline staff, other health service providers, and then Ministry of Health officials, and other kind of higher level system individuals. And so a closer exploration of day program purposes with day program directors in a Canadian context appeared warranted based on this literature. And so my master's thesis had two research questions guiding it. What are the purposes of day programs according to their directors? And what factors enable or challenge day program directors' pursuit of the purposes? And out of an awareness of possible knowledge transfer or production difficulties with investigator-led research, and also due to my professional connections that I've kind of built through my formal and informal education, I used a collaborative research approach, specifically integrated knowledge translation, or IKT. And IKT is defined by the CIHR as a dynamic and iterative process that includes synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of Canadians, provide more effective health services and products, and strengthen the healthcare system. And so voluntary knowledge users were involved throughout the IKT research cycle with my master's thesis. And these knowledge users informed the research questions that we just saw, the research methodologies, data collection tools, some of the interpretation of the findings, and some of the dissemination activities, such as deciding who we wanted to engage with presentations, flyers, and so on. And this IKT approach was implemented alongside an exploratory sequential mixed method study design. So the study began with a phase of qualitative research, which was then followed by a second phase of quantitative research. And these two phases were then integrated and interpreted together. And this approach allowed the second phase to be responsive to and build on the findings of that first phase, and was a strategy to further inform, develop, and refine the findings. And you can see it kind of more specifically mapped out here in this table below. So the first phase used a qualitative descriptive methodology where semi-structured interviews were used to collect data, and data were then analyzed using qualitative content analysis. And the second phase also used a descriptive methodology where a cross-sectional survey was used to collect data, and data were then analyzed using descriptive statistics, including measures of frequency, central tendency, and variance. Participants of this two-phase study were recruited from one large Ontario Health region, and for anonymity, I won't share the specific region, but I can provide some contextual information. So this region represents about 30% of Ontario's population and includes multiple legacy local health integrated network, or LHIN, subregions before they came together as Ontario Health regions. Participants were purposefully recruited using my professional connections, and we also used snowball recruitment by drawing on participants' own networks. To be included, participants needed to be a current director of a Ministry of Health funded day program in the health region. And out of awareness that there are different labels for this kind of director role, we define director as someone who managed day programs as a primary responsibility in their portfolio, and were primarily responsible for connecting with legacy LHIN or Ontario Health representatives regarding their organization's day program or day programs. Participants also needed to be English speaking, as I can only speak English, and I was conducting the interviews as well as creating the survey. And it was important that each eligible individual be given the opportunity to share their perspectives in both phases of the research to build a sense of respect, ownership, and collaboration throughout the research process, and uphold the IKT approach of the research. And for this reason, participants were able to participate in both or either phase of the study, depending on their availability, but they were not required to participate in both phases. And so we can see that this resulted in 23 participants representing 20 ADP organizations. So then we're moving to the findings part of the presentation. So we'll start with the first phase and the first research question, which was regarding the day program purposes. So this purposes category captured the reasons, aims, and objectives of day programs. So essentially what day programs are intended to do and provide for clients and caregivers, as well as other parts of the system. Phase 1 findings substantiated all three generally accepted purposes, as well as calls for the expansion for these two here. And we also saw some novel findings that related to the previously established purposes, and then others that kind of build on these in different ways. So first, I'm going to focus in on the providing support and respite for caregivers. And although this is a well-established purpose in the ADP literature, it's kind of been confirmed as a purpose that day programs can achieve. The study did find some nuances with this purpose. So a few participants, but not all, pointed out that they thought it was important day program services be provided outside of caregiver and client homes. So as one interview participant said, you don't always feel like you're getting that full break when you can't leave your home. This participant then went on to explain some of the things that caregivers can do when day services are provided outside of the home. And these discussions regarding setting were likely influenced by the COVID-19 pandemic and the transitions of some day programs to virtual services. As mentioned previously, phase 1 interviews also identified several other purposes not commonly addressed or explicitly included in research or grade literature that discusses day program purposes. And for this overview of the research, I'll just focus in on 2. So many participants referred to person-centered care or some variation of it. For example, this interview participant said that day programs need to be person-centered. So what an ADP organization can offer may be very different than what another day program organization, for example, may be able to offer. And she thought just letting people know that we're not all the same in what we're able to provide, but ultimately we're all striving for the same end goal. And this quotation felt notable as it acknowledges that the process of reaching this day program purpose might look different for each organization, but the end goal remains the same. Moving to the operation of the healthcare system, one interview participant stated the day program allows the entire system a chance to breathe. And this is accomplished by gathering a lot of really vital and key pieces of information, kind of about the client and their preferences as well as their caregiver, but also then preventative elements through the services that day programs provide. Moving to the second research question, the enablers category captured factors that participants found supported their ability to meet the day program purposes described in the category we just discussed. And subcategories were inductively identified as part of the organization stage of qualitative content analysis. And as with previous kind of categories, I'll focus in on just 2 subcategories in this overview. So participants described a variety of collaborations and partnerships that support their ability to pursue day program purposes. For example, this participant identified the relationships they have with other day program organizations in the region as something they felt makes their own practice richer and more diverse, thereby enabling them to pursue their day program purposes. Client and caregiver involvement was also described as supporting day program system level purposes in this quotation. So one participant noted the relationships developed with clients results in day programs having the ability to circumvent unnecessary emergency department visits because they're able to catch things a little bit earlier. And these relationships are then supporting the purpose to prevent or delay relocating to other facilities. Moving to challenges. Challenges were factors day program directors perceived to present difficulties or act as barriers to achieving their day program purposes. And many of the subcategories contained in this section reflect the enablers described in the preceding section, demonstrating that some factors can be both beneficial or constraining depending on the context. And as with the enablers, I'm going to focus in on just 2 in this overview. So every single one of the interview participants commented on the lack of base funding for day programs and how this influences their ability to meet their day program purposes. In this quotation, an interview participant expanded on the implications of this stagnant funding as not keeping up with the care and support needs of the clients and caregivers they are now interacting with. Moving to perceptions of day programs. This subcategory pertained to the perspectives other relevant groups such as health services and clients and caregivers had regarding day programs. So many participants commented on the perceptions of day programs as not legitimate or not a formal part of the system. And we can see here, this interview participant said, I know there's a feeling that our services are kind of this mom and pop social club. So not really a legitimate part of the system. In preparation for phase 2 of the research, these phase 1 findings, specifically the content of categories and subcategories, were transformed into a cross-sectional survey of phase 2, which knowledge users reviewed and kind of provided feedback before it was disseminated. And as with phase 1, I'll start with the purposes and provide a highlight or overview of them. For purposes survey items, participants were asked to rate the current and then the desired relevance of the survey items. I'd like to note that providing person-centered services, which is something we discussed in phase 1, had the highest average of mean ratings for both current and desired relevance. The highest current mean rating also demonstrated the relevance of therapeutic recreation services that day programs provide. And the highest desired mean rating also identified social aims to create community between clients, caregivers, and staff. And both of these connect to those psychosocial purposes of day programs discussed in the broader day program literature. We also analyzed the relative differences between current and desired purposes, and we saw that the average ratings of all purposes increased from current to desired. And this increase points to the relevance of the purposes that were kind of identified and discussed in phase 1. However, the capacity of day programs to meet all of these purposes does need to be considered. So although day programs are a part of and can support the healthcare system, the sustainability of being everything to everyone, as one interview participant described, should be addressed. Moving to the enablers, participants were asked to rate enabler survey items according to their strength of support and then the degree they promoted day program purposes. And I'm reviewing the top 3 highest mean ratings for each category, as well as the lowest mean rating in this presentation today. So starting with the strength of support, the highest strength of support was for providing structured services, which support clients and caregivers, and reflects interview participants' reference of the benefits of routine for clients and caregivers using day program services so that these individuals know what to anticipate when they arrive. Survey participants also rated strengths-based or restorative approaches as something that strongly facilitated their ability to meet their purposes. So for example, adapting activities to client abilities might maintain the physical and psychosocial functioning and well-being of clients more so than other approaches that could be used. Survey participants also noted the influence of staff communication systems as enabling their pursuit of purposes. So frontline staff are a very integral part in providing day program services, so it makes sense that systems that support their ability to provide programming would be beneficial to achieving day program purposes. Moving to the highest mean ratings for the degree enabling survey items promoted day program purposes, the highest degree of promotion highlighted the importance of those social connections through familiar and trusting professional relationships with clients and caregivers in their involvement with day program services. And as we saw in phase 1, these relationships can prevent or delay the relocation of people to care facilities. And these relationships can also promote day program purposes to address the psychosocial and physical functioning of clients and caregivers by providing more relevant and interesting programming. We also see the importance of frontline staff again, where empowering staff to provide creative and responsive recreational opportunities was seen as something that will promote their day program purposes into the future. And as with other results that we've seen, this might be influenced by the timing of the research during the COVID-19 pandemic, where a lot of these creative and responsive recreational opportunities were being offered. Finally, having a staff member dedicated to caregiver support was identified. And while participants and knowledge users recognized and communicated that day programs are not generally funded for caregiver support and respite specifically from the government, this is an increasingly important function of day programs now and into the future. Turning to the lowest mean rating for both categories was having an affiliation with long-term care. And we speculated that this reflects the low number of service providers that are formally affiliated with the long-term care right now. And it could also reflect that the nature or quality of these affiliations with long-term care could be improved so that when they do exist and there is a co-location or a partnership, they are more enabling. And lastly, participants were asked to rate challenging survey items according to their prominence and their urgency to address. The highest mean rating for the prominence was for lack of base funding increases, reflecting both phase 1 interview participants and then the broader day program research that I had reviewed before beginning my master's thesis. The survey results also demonstrated the prominence of supporting the level of caregiver needs and burnout, which is likely reflective of both the timing of the survey during the pandemic, but also possibly the lack of funding day programs received to dedicate towards supporting caregivers specifically. And finally, survey results also noted the prominence of the difficulties in defining and measuring day program success. So many existing metrics are not nuanced enough, and the clients ADPs work with may not show the improvements that other services might expect to see and demonstrate, like rehabilitative services, for example. We can also see the supporting the level of caregiver needs and burnout reflected in the highest mean rating for the challenges that were very urgent to address. And survey results also demonstrated the urgency to address those perceptions of day programs as it hinders their operation, their connections with other health service providers, and then the experiences of clients and caregivers in transitions into and out of day programs, and even while they're still in the program, interacting with other service providers that they may kind of be engaging with. Finally, survey results identified the constraints of day program physical spaces in being able to serve the number of clients that could benefit from adult day services. So physical space constraints can relate to both the size of the space, but then also the degree to which the space is purpose-built. So if you're kind of operating in a building that wasn't intentionally kind of constructed for a day program, there may be some constraints operating there as well. The challenge with the lowest prominence mean rating related to staff expectations of their roles and responsibilities, which suggests that many participants found this low or moderately challenging. And the challenge with the lowest urgency to address mean rating was the ADP status of being under the umbrella of a larger organization. So that is an organization that offers other services in addition to day program services. And any challenges that come with this affiliation appear to not be as urgent to address as these other challenges relating to caregivers, the broader healthcare system, and then the physical space of the day programs. So directors' perceptions of the purposes align with the 3 commonly accepted purposes, as well as researchers' calls to extend these purposes, which I think we kind of saw in the phase 1 and phase 2 findings. But we can also see how the findings really expand on those established and expanded purposes in nuanced and novel ways. And these findings have practice implications for the ADP director group. So day program directors can and have used these findings to strengthen their communication of day programs in this health region through an increased understanding of their several purposes. And this updated collective understanding of their purposes might also help with day program awareness from other services and groups, such as other healthcare providers and then clients and caregivers that aren't using the service yet, but might be interested in it. This research also identified several challenges and enablers, and a significant finding was that these challenges and enablers can be differentially experienced across the health region, depending on the context. And these differences are reflective of that individuality of day programs, their geographic location, their history with their local health integrated network, and many other areas. But while there are some differences in how some of these factors are experienced, there are some more generally experienced factors as well, such as the funding and resources. And knowing about these differences and similarities can support the prioritization of action areas in this larger health region through the collaboratives that exist, as well as the smaller subregions and their partnerships. So as with all studies, my master's thesis had some strengths as well as some limitations. A few of the strengths are that it addressed a gap in the research with day program directors and day program research in Canada specifically. It also used an IKT approach to strengthen the relevance and uptake of research, and it incorporated both qualitative and quantitative methods in the exploratory sequential mixed method design and adhered to measures of quality for mixed method studies. In terms of limitations, as far as we know, about half of directors that could have participated in this study, which limits the transferability to the entire Ontario Health region. And day program directors that chose to participate might not share similar perspectives as the directors who did not participate, resulting in self-selection or non-response bias. And it's also possible that social desirability bias was present, as participants may have strived to present themselves and or their day programs favorably. So in terms of future directions, I'm continuing to engage with and mobilize day program directors as a uniquely positioned and key day program perspective. The interest of the day program directors I've been engaging with has continued throughout the rest of the IKT cycle, which kind of doesn't end as we saw in that picture. And specifically, we're kind of in the application and dissemination of finding with other groups, and then also considering how we can kind of scale up this research with my PhD kind of program of research. So although day program directors are strategically positioned to interact with many other groups, it's still very useful and important to gather and integrate other day program perspectives to inform purposes and potential challenges and enablers that these other day program partners experience. My master's thesis was also conducted with just one Ontario Health region, so it might be interesting to compare and contrast with other Ontario Health regions that exist. And we can also learn from existing collaboration and partnerships. So for example, The United States has the National Adult Day Services Association, which brings together day programs across the nation. And this association also supports a lot of the research conducted in the US. There's also a lot of really interesting research coming from the UK now as well regarding day programs involving directors and frontline staff. And knowing that we want to gather and integrate other perspectives and more perspectives, it might be interesting to learn from them as well. And so it's just really exciting to consider the opportunities to connect and expand on this literature and contribute to it in kind of practical and interesting ways for the Canadian context through my proposed program of research. And so I'd like to acknowledge the participants and knowledge users that kind of gave a lot of time and insights into the research. My supervisor, Dr. Brad Neisner, for being there for my master's and now for my PhD. The Healthy Aging in a Unified Society lab members as well. And then awards and funding that I've received from the CIHR, OGS, and then of course, CAG with the Donald Menzies Bursary. I hope my internet connection became relatively stable, and I'm happy to answer any questions that people have now.
Yes, your internet connection was fine, Deanna, so that was great. So thank you very much for that very interesting presentation. A topic very near and dear to my heart, and I did my PhD research on adult day programs, actually. So thank you so much for that. You're welcome now to engage Deanna in some discussion. If you'd like to speak, you can use raise your hand feature. So on my computer, it's along the bottom of my screen under reactions, and you can click on raise hands, and I'll try to keep track of that. And you can also post questions in the discussion, and I can kind of summarize those and have some discussion about that. So you are welcome to unmute yourself as well. So let's see, Deanna, there's a comment here from Blessing. So the question is really about what we have available for adult day programs in terms of culturally specific day programs and integrating racially marginalized older adults in day programs. So I know that you worked in a relatively limited way with, one area in Ontario, but did you have any examples of that in your work?
Yeah, thank you for your question, Blessing. In the region that I was working in, I'm not aware of any culturally specific day programs. Aside from, we did engage with an Indigenous day program for, I think, phase 1. They were an interview participant, and so we received some kind of feedback and their results as well. But it was limited in in this research. And it was something that participants actually brought up and discussed. I'm just looking at my thesis right now as well as something that I remembered in terms of hiring staff that reflect the diversity of the community, because they did recognize that the individuals that are attending their day programs don't necessarily reflect the diversity of the broader community that their day program is operating in, and experiencing some kind of challenges in reaching and supporting and maybe addressing perceptions of day programs that different kind of groups might have. And I was also just trying to look through my thesis now in regards to your question. I do remember there being one research study that was kind of regarding culturally specific day programs and participants' experiences with that. So if you're interested, I can kind of take a little bit more time after the presentation and kind of send that to you as well. But it is a limited aspect of both the literature and then the participants and how they kind of spoke about it with this project.
Yes, a really important point for any of our health services. So thank you. Thanks for that. Any other questions or comments for Deanna? Yes, Sarah, go ahead. I see your hand raised there. You can unmute yourself.
Awesome. Deanna, thank you so much for such a great presentation. I really enjoyed listening to you and this really awesome thesis that you did for your master's. That's amazing. I am about to begin. I'm a project coordinator for at UBC. I'm a postdoctoral researcher, and we're starting an evaluation study of an overnight day program, right? I think we need a new name for this, but it is essentially overnight respite for community older adults living with dementia. And I'm wondering whether or not anybody in your in your participant group ran overnight programs, or it seems to be this sort of one-off thing. I don't think it's very common, but just wondering what your thoughts are on that, if anybody in your study ran an overnight program.
Yeah, that's another great question. Typically, it was the day programs that were affiliated or were under the umbrella of a larger organization where they then had overnight respite. So, for example, the day programs that were affiliated with like the Victoria Order of Nurses, they would have like an overnight respite just because they were kind of a larger organization that had the different departments to offer that. But I am aware of quite a few within the region. So if you're interested, I could kind of potentially reach out to them and connect you both. I know that there's been some challenges specifically with the pandemic and being able to open again. But I would be happy to kind of connect with you, the two of you together for sure.
That's awesome. Thank you. I will shoot you an email. I'll find your
Awesome.
email. Thanks.
Yeah, thanks, Sarah. Catherine Fries, hi Catherine, posted a comment in the chat section about if you are aware, Deanna, about the background of the staff who work in adult day programs. So do they tend to be, in your experience, healthcare providers or community workers or some other background?
So I was working specifically with the directors. I think I have some information about their highest level of education. So they had some kind of like diploma, bachelor's degree, or master's degree. And it kind of was spread across the board from what I can remember. I know that there were some people that had social work experience, for example. One individual who started off as a recreation therapist and then kind of moved through that specific organization to become kind of more of the director. Quite a few that have that kind of recreation therapy experience. Some that were more of a mixed model. So they had those social and medical kind of purposes that they were pursuing, had a nursing degree, for example, so they could speak to both the medical and kind of social aspects of health and well-being, from what I remember. So kind of a real spread, but mostly in kind of a health-oriented background.
Yeah, I know that you really collected data from the administrators of the programs. Did you get a sense of the people who work in the kind of the front line, like the workers in these programs, the staff members?
So a lot of individuals that were frontline staff members were therapeutic recreationists, or a lot of personal support workers as well. So for example, a common model that I was seeing just in this research was you would have one expert in therapeutic recreation, and then your staff model would be made up of personal support workers who could then engage in that kind of social engagement, but then also have the personal support needs as well.
Right. Okay, great. Thank you. David, you go ahead, David.
Yes, I was just wondering how much government support, especially Ontario government support, you get, because this is a massive problem in the future, especially for dementia. And I'm just wondering how seriously they take this problem and how to ratify it in the future.
Yeah, that's a great question. One of the policy documents that I referenced in the beginning about the kind of increasing interest in Canada was actually a dementia report from the Public Health Agency of Canada. So it does seem to be kind of increasing, and specifically in regards to people living with dementia, which isn't necessarily reflective of all the day programs that I was and continue to research with, but is kind of a driver for the increased interest in day programs. I know the region that I'm working with right now, and they are working more closely with Ontario Health right now to gather more information about their capacity and how they're kind of working right now and how they'd like to be working in the future. So even just in the 10 or so years that I've been involved, I'm starting to see a little bit more interest from a higher kind of government Ministry of Health level. But as with kind of any health service, I think we all think that there could probably be more attention to the specific program that you're working with. So there's an increased awareness and increased interest, but I still think there's opportunities for more awareness and education of the role that day programs can serve and how they need to be supported then in that role.
Wonderful. Thank you very much for that question, David, and Nicole or Deanna for your response. It's a really important point. I know when I studied day programs a long time ago, that issue of funding and public support is really interesting and still relevant today, interestingly. Did you get a sense of if there was a cost for the people attending the programs on a daily basis?
Yes, every program had a cost associated with it. There was one subregion that was associated with a legacy LIN region where they had standardized the costs across the region. And then the other regions that I was working with, it was a little bit more variable depending on their services. For example, a lot of the dementia specific programs had a higher client fee service than the integrated adult day programs.
Yeah. Okay. Wonderful. Well, I promised Deanna that we would be finished by 1:45 so she could get back to an event that she's part of today. So I wanted to thank you, Deanna, very much for this really interesting presentation. I'm so excited that you are working in this field of adult day programs, and I'm really curious about how the rest of your research progresses. So thank you very much for focusing on this and for such a great webinar. Thank you all for attending our presentation today, and just again remind you that the information will be available on the website, so we will have the recording posted. So have a wonderful day, everyone, and thank you for your participation today.